Hello, my name is Shayna DeVoe. I'm going to be doing just a brief presentation on some terms that relate to disease and pathophysiology. Throughout this, I'm going to be using the disease leprosy to help provide some examples of the different terms I'm talking about. So the first term I'm going to go over is the definition of disease. Disease can be defined as an acute or chronic illness that one either is born with or maybe acquires during their lifetime. And this disease can potentially physiologically cause dysfunction in one or more systems. So leprosy is a chronic illness as opposed to acute, and it does affect multiple body systems. The next term I'm going to go over is disease classification. This is a way of describing or categorizing diseases. They could be acute, chronic, infectious. Leprosy, or also known as Hansen's disease, is an infectious disease. It is also a chronic illness. Etiology refers to the causal factors of a disease. In the case of leprosy, it is caused by a bacteria called the Mycobacterium leprae. It is a long rod-shaped bacteria. Pathogenesis, the next term, refers to how a disease evolves, kind of like its life path. The pathogenesis for leprosy is slow. The bacteria take a very long time to multiply, so it could be a year or it could be 20 years before the bacteria have multiplied to a point where a patient would experience symptoms. Which brings me to my next term, symptoms. These are subjective experiences by the patient. They are not things that we can observe ourselves from an outward perspective or measure. Symptoms of leprosy could include, say, muscle weakness or numbness or sensations of pain and heat. These are things that a patient can experience, but we can't, and we can't observe them. Signs are objective manifestations, things that we can observe and that we often can measure. Signs of leprosy could include like telltale sign, discolored patches of skin, sometimes loss of eyebrows or nose deformity. And these are, as I said, things that we can measure. They're objective. The next term is syndrome, and this is a compilation of signs and symptoms to present a clinical picture of a disease. For example, you might have a patient present who is expressing that they are experiencing muscle weakness and that they, are numb in certain areas or that they have sensations of pain or heat. And at the same time, you may be able to observe that they have lost their eyebrows or that they have the discolored patches of skin. So the compilation of these together creates this clinical picture of leprosy, which often helps in diagnosis, which is the next term. Diagnosis is basically designating the nature or the cause of the problem. For leprosy, it's often diagnosed, by first sort of seeing the compilation of signs and then, mixing those with the symptoms patients report. And then to confirm your diagnosis, a clinician would often takes a biopsy of skin or nerves and observes them under a microscope to see if they can identify that Mycobacterium leprae, or that causing bacteria. Next term is complications. These are additional factors which can exacerbate a disease or the outcome. Sometimes these complications are caused by the disease itself, and sometimes they're caused by the treatment course. In the case of leprosy, while it is curable, if you don't receive treatment soon enough, you might have irreversible damage. For example, you might have that nose deformity that I talked about, which sort of leads to a concave nose. This could be irreversible even if you are cured by receiving the proper treatment. The next term I'm going to talk about is prognosis. This is the probable outcome or prospect of recovery. In the case of leprosy or Hansen's disease, It is curable. The treatment course is, well, it's curable if it's caught early enough. And the treatment is taking a few antibiotics for 1 to 2 years. Um, so that is the only treatment at this time. Final term is diagnostic media. These are things which aid in diagnosing or determining underlying causes of a disease. Quite often they are, substances like agar and growth plates that you can grow bacteria on to identify it. In the case of leprosy, my understanding is to diagnose, we don't grow the bacteria. We simply do a biopsy and observe right from that if we can see the bacteria in the biopsy sample. I hope you've enjoyed this presentation. Thank you for listening. And that's it.